Hello, I'm Dr. Joe Clausen. I'm a naturopathic doctor in Calgary, Alberta. I'm the owner and clinic director of Fish Creek Naturopathic Medicine, and I also work as the clinician support specialist for the Rocky Mountain Analytical Laboratory. I wanted to provide some information about the IgG food tests because there have been recent media reports that have been very critical of the test, and I feel that they have been unfair, biased, and I fear that they may prevent people from getting access to some testing that could be very helpful for them. So I want to talk about the clinical validity of the test and the perspective in which it can be used and which it cannot fairly be used. And I think there's a lot of misunderstanding about the test. So I'd like to proceed with some information for you. So in this presentation, I want to talk about a few items related to the IgG reaction and the food-specific antibodies. In particular, that the IgG antibody is very different than the IgE. IgE involves the type 1 hypersensitivity, and that's what we often vision when we talk about allergy. It looks like a hay fever or a bee sting, and perhaps that at its worst, it looks like anaphylaxis. The type 3 reaction, which we have with the IgG antibody, can take a long time to hit its stride. It can be several hours to several days for that reaction to occur. And that's why it's so hard for individuals to identify their delayed sensitivity food reactions. The antibodies are produced by our immune system because it's encountered these foods and is mounting a delayed response. The difference is that the IgG response does not release histamine, and so it releases other inflammatory chemicals that cause a systemic inflammation, which may in turn frustrate other medical conditions. So it doesn't necessarily cause your asthma, but it does make the asthma or eczema flare. The clinical significance of IgG antibody testing is supported by much literature and research. I'm going to quote those throughout this presentation, and I really encourage you to also go and look at these publications or these papers in greater detail, and that the clinical value is well established in the literature and also by the practice of thousands of clinicians across Canada and the United States. We use this well in clinical practice, and I think it is a fantastic test, but it needs to be understood in its context and used appropriately. And I will then answer some frequently asked questions that many practitioners as well as our patients have regarding the testing. Approximately 12% of the US population can be diagnosed with reactions to foods. Some of those are IgE food allergies. So IgE or type 1 food allergies are the classic allergy picture. It looks like hay fever or a bee sting, and unfortunately can potentially be anaphylactic. The food intolerance is not an immune process. The food intolerance, such as lactose intolerance, is a failure to fully digest a food molecule, typically a sugar, and that sugar migrates throughout the digestive tract and then causes further trouble. It can be very distressing and uncomfortable, but it is not an immune moderated phenomenon. Celiac disease. And celiac disease is increasing in incidence across the world, and it can be a very serious ailment damaging the tissue of the small intestine, but not to be confused with a gluten sensitivity where, again, although a patient is uncomfortable, there is not the destruction of the tissue of the small intestine. And the non-IgE food allergy, which is the type 3 or IgG food sensitivities that I'm going to talk about. It is an allergy in the sense that it is an inappropriate immune response to some item that we should tolerate, but it is not a type 1 histamine moderated event. It causes other inflammatory chemicals to be released. So up to 90% of the presumed food allergies are not type 1 allergies, but they are in fact sensitivities or intolerances. So adverse food reactions, and that's the presence of any symptom picture, very commonly migraine, asthma, dermatitis, so eczema or psoriasis, IBS, and some other very concerning inflammatory diseases. So the studies suggest that they may be related to the food sensitivity, and that the food-specific IgG testing can really help to reveal an issue that a person may not be able to identify on their own, even though they are paying attention. The reaction can take hours or even days to become fulminant, and so even the intelligent observer may not be able to put that together because it's several days after they've had that food exposure before they have a concern. Or it's a food that they have on a fairly consistent basis, and so there's really not an opportunity for that reaction to diminish. And that the IgG food reaction can play a role in many other adverse food reactions. So what are IgG antibodies and what's their significance? Well, IgG antibodies are type 3 and type 4 reactions, and they provide the majority of the antibody-based immunity in our system. It's interesting that they can also cross the placenta to give immunity to the fetus, but also they cross through breast milk, and so they can pass from mother to child. So this is the case where even a breastfed infant who might have some significant issues such as eczema are in fact getting it because the mother is having a food reaction and is passing it through the milk. The presence of an IgG antibody means that you are having an inappropriate, well, you're having an immune response to a food. It is normal to have small levels of reaction and IgG antibodies in circulation, but when that becomes a very high amount of circulating antibody and it's meeting the antigen, the food product, or the what we might call the allergen, that means you now have the inflammatory response. So an example of that is here where there's a demonstrated high IgG response in a large subject group to milk and their derivatives. So the antibody level in the circulation is a great indicator that this person's having an adverse reaction to food and food hypersensitivities. This is a research paper that I really think is important. Using over 5,000 participants is a fantastic number to get good, solid results from. And that these patients were subjected to the food sensitivity test, and they avoided the foods that were shown to be high on the test. They were followed up after 3 months of compliant behavior on those foods, and in fact 76% reported a significant improvement in their condition. Others reported some improvement, but 76 reported a significant improvement. That is really a terrific proportion of the test group that saw a benefit. And then to validate the study or the results, they had them return to their foods, and in fact 92% of those individuals reported that the symptoms did return upon reintroducing the foods. And that to me is a very solid paper that does validate the clinical use of this test. And that is what today's talk is about, is that this test is really helpful for a lot of individuals, and that they will see benefit to many different conditions. There is not a direct relationship between one food and a particular ailment. It is the sum of having an excess of reactivity and not clearing the antibodies and the antibody-antigen complex that then fans the flames of these other conditions. So in the test of those who had IBS or Crohn's disease, 80% saw an improvement. The individuals with asthma saw 78% benefit. Eczema, acne, psoriasis, 76% benefit. These are fantastic numbers for providing a benefit for chronic ailments for which many people do not seem to find a cure or a benefit without using suppressive drugs that may in fact have other side effects. And I am not saying that we should not ever use the drugs, but that using them to suppress the immune system really can have some long-term effects that we may not want all our patients to experience. So the mechanism of the IgG-mediated sensitivity. The change in the intestinal permeability is a very important concept here. So if we view the digestive tract as a tube that is going from mouth, gum to bum, as it were, that the integrity of that tube is very important. And if there is inflammation, then some molecules that may not normally have the chance to migrate through that tissue and encounter our immune system now have that opportunity. So in the intestinal diseases, these larger molecules, and so they could be microfragments, but especially portions of foods. So a long protein like gluten or albumin or casein from milk may be broken into smaller chunks, but they haven't fully disintegrated, and the immune system can in fact identify that, and now we have that sensitivity. This is where some people may find that there is a before and after. They say that they've never had digestive problems or eczema or acne coming on later in life, and then they had a flu or some event that caused a disruption in the intestinal permeability, and ever after that they have now developed this sensitivity to a food. So it's not something we're born with, and it can happen at any stage in our life. So here's an illustration of a healthy gut barrier, and you can see that there's a strong barrier here, and that these tight junctions are well sealed, that the contents of our gut will not be encountering the tissues and making it into circulation. And then in this case, you see that held, whereas in the case of a damaged intestinal mucosa, the epithelia, or the lining layer of this tube, and that they can migrate through and now encounter our immune system, and that's where the disease process begins. And you can see the antibody formation identifying these foods, and the inflammation progresses. And that can happen in that inflammation then circulates through the body and causes further distress. So neurological disorders, metabolic syndrome, and I really use this test well for individuals who have obesity. And if I hear the statement such as, you know, Joe, I'm doing everything right as far as I know. I'm eating well and eating light. I'm getting physical activity, and my weight, in fact, I see no change. And this can be one of those metabolic blocks. But for sure, individuals with metabolic syndrome, it's high cholesterol, high blood pressure, high blood sugars, and central obesity, can do very well to reduce this inflammation. There's many studies supporting the importance of the gut and food intolerance with depression and anxiety and ADD, ADHD, autism, etc. And the autoimmune diseases as well. And this is a place where, again, I feel I use the test very successfully. and my patients have been very happy with their results. And I really feel clinically that it's when the patients are referring their friends and family, or that their friends have said, wow, why is your condition so much better? And they'll say, well, I went and did this weird test with my naturopathic doctor, and wow, I really didn't think I had an issue with foods, but it showed clearly here on the page that I've got some issues, and I've followed that advice, and I do feel better. So here are some examples of how we get that altered intestinal permeability: poor diet choices, stress and emotions, and a low stomach acid, in my mind, are very, very significant contributors. And that this leads to the food intolerance, poor absorption of certain nutrients, dysbiosis. And again, we're seeing so much research talking about the importance of the microbiome, the gut flora, and we need to pay attention to that. But yet, if we have a food sensitivity and all this inflammation in the gut, it's going to be very, very difficult to restore that healthy microbiome again. So we have dysbiosis. And so the toxic burden becomes excessive, and the poor liver has cells called macrophages, and it's their duty to pull these antibodies and antibody-antigen complexes out of the circulation. And it really is the case that there's a tipping point where if we can stay under the threshold, even though we are making some modest reaction to the foods, there's really no event because it's clearing. But if we pass that threshold, that's when we start to see the symptom picture emerge. So the circulating immune complex, and that's the unique thing about the type 3 or the IgG antibody, is that the antigen, much like a lock and a key, meets its target. It is specific to that food, and that half-life may be very short when the immune system is working well and the liver can clear it. But in many cases, the half-life, the time for that antibody to diminish by a half, can be 21 days, and in fact as long as 90 days in some individuals. So you can see where they become increasingly toxic and inflamed with the circulating antibody complex. Now, this is a really interesting area. The MAST cell, it contains histamine and is largely associated with the type 1 or that IgE, immediate onset allergy. But there is now a good understanding that certain conditions, especially hives and ongoing skin inflammation, can be related to the delayed sensitivity IgG antibody activating the mast cells. And here's some research that's talking about that. I won't go into that, but you can see the citation and follow that up if you're interested in assessing the GI disorders. And that's what makes sense. Everybody would easily agree that we should see some digestive complaints when we have food sensitivities. But in fact, many people don't have a digestive complaint. They have these other inflammatory conditions. Again, in my case, I test a lot for eczema and asthma and other skin conditions, depression and anxiety, and weight management. And so the importance of maintaining the gut barrier function to reduce these food sensitivities is very important. So not only may we have to alter our diet, but in fact we have to do some gut healing and make sure that the patient gets nutrition. And again, we're seeing a 74% improvement in 74% of the individuals in the test saw an improvement even at the 1-year follow-up. And I think that's really exciting for long-term benefit by using lifestyle and dietary choices. So you can see the myriad inflammatory diseases that can be affected by mast cell involvement. And so gut dysfunction is, again, sort of obvious, but in this case, it's triggered by some dental procedures. And I wouldn't single out dental procedures, that's what they happen to study, but I would further take that as proof that it can be many different incidents that would cause the onset of these concerns. And this, the Wilders-Trushing paper is widely cited, and it is a very nice piece of research. It's got a good design, and the conclusions are appropriate to the data that they found. And we see these higher IgG antibodies in obese children, and that's associated with further low-grade systemic inflammation and other health risks down the road. That the avoidance of the foods to which they have IgG is indicated, and that would potentially reduce the further risk for more complicated illnesses related to obesity, like type 2 diabetes and cardiovascular. So you can see here in this results that these individuals have a change in the grade of their reaction. So this test is using slightly different numbers, but the patients have gone in this case from a 4 to a 2, so a very significant improvement in their overall inflammation by managing their diet. Inflammation is really at the heart of the presentation of many diseases. So whether it's neurological disorders or cardiovascular disease, mental health, even cancers and pain, diabetes, and other chronic lifestyle illnesses. So if we can see a systemic reduction in inflammation, I think we've really done a great service for the patient. So what's been associated with IgG food sensitivity? The delayed food allergy, IBS. And IBS is in fact one of the most common concerns which brings people to visit their family practitioner. So there's an overall burden on the healthcare system over and above the burden on individuals. And when you think of the cost of missing a few days of work or just not being up to snuff when it comes to enjoying your family and your personal activities, or if you're an athlete, excelling in your sports because your digestion is off and you have inflammation, certainly we can improve on that by having identified the food sensitivities and managing those foods. Arthritis and inflammation, migraine for sure, asthma, digestive disorders. You can see the inflamed and then the healed digestive tract in individuals who have managed their food. You can see all the redness there indicating that inflammation. And the mental health and behavioral disorders for sure are not necessarily caused by these reactions, but the inflammation from these food sensitivities fan the flames of their other concerns. I'd like to make that clear. It's not the entire story. It's one contributor that we won't see, whether we're using medication or other treatments, the full benefit if the food sensitivity remains. In this case, primary headache in children, and they saw wonderful results. So this is probably why I've done this video tonight, and that's because we've had yet again, and in my 13 years of practice, I believe this is the 4th time that national media has run a piece critical of the food sensitivity testing. We see and hear from the medical community criticism and skepticism, if not outright childish mocking. And I really think that's too bad, because the testing is fantastic used in its own context. And the key to that conversation, I think, has always been, and we'll see in a little while, the Canadian Allergy Association, the medical association, talking about how the testing isn't appropriate to evaluate allergy. And that is the point I would also make. It is not identifying allergy. It is identifying the sensitivity. So you cannot criticize a test for being inappropriate for something that it is not used for. It's really that simple. This test is not and should not ever be used to identify type 1 allergies. So we talk about a balanced medical review. Well, in the article in the Canadian Medical Association Journal, and they look at, they comment that food-specific testing is being used to identify food sensitivities. And this testing has not been validated nor supported by research. I've already shown you a few nice pieces of research, and if you view the food sensitivity fact book, or if you look at the other documents that I've posted, you'll find that there is actually very much research. And so as a journalist, I guess I'm dismayed that when that research can be found by a simple click on the internet, that and our medical professionals say, oh, well, this testing hasn't been validated and is not supported by research. It's flat out wrong. It is flat out wrong, and I really hope that that does not cause people to skip getting tested when it could provide them much benefit. So the Canadian Society of Allergy and Clinical Immunology, again, confusing. With the IgG antibodies, the IgG, there are subclasses, and IgG4 is in fact not an inflammatory antibody. And so there are some tests that look only at IgG4, which could be a blocking to a type 1 allergy. So it's helping to desensitize. But using that as an indicator of the allergy is also inappropriate. So keep that in mind if people are presenting IgG4 tests. The test I use from Rocky Mountain Analytical, the FST, is the same one that was used in that first paper I quoted with 5,200 individuals seeing that overall benefit. And so the Rocky Mountain Analytical FST is a total IgG, which does include the inflammatory IgG. So here it is that what they're saying in the Journal of Allergy and Clinical Immunology is that the IgG4 should not be used, not that IgG should not be used. It's subtle, but there. And as they look for the meta-analysis of 347 papers that they cite in the medical review, not one looked at the IgG-mediated condition. So again, you cannot criticize something for not being something that it is not. And you see the chart at the bottom looking at the adverse food reactions and the immune-mediated and the non-immune mediated. And again, some people may do the testing and find that they don't have immune problems with their foods, but in fact there are physical and chemical digestion or gut microbes, gut flora problems with their foods, and it's not the immune system directly causing them grief. IBS. And so one of the most common GI disorders, a prevalence of up to 30% in some populations. That's, more than a quarter of individuals. And when they may try a food elimination diet, they come up short. And it's because elimination diets, as much as I would love to use them because it would make sense, but we have so many processed foods, mixed foods, cross-contamination, and teaching somebody how to really avoid where some of these food sensitivity, the offending foods, are subtly used in many other things. As an example, the number one food ingredient in soy sauce is often wheat, not soy. And so teaching people how to eat clean on an elimination diet can be quite tedious and certainly will take more than a few weeks to become very good at. So we can see that the IgG levels are higher in patients with IBS. Again, more research supporting the use of IBS and the food-specific testing. So frequently asked questions. Do I have to avoid these foods for the rest of my life? Well, not necessarily, but you need to avoid for at least 3 months. And if the reaction is quite large, for sure you would look at 6 or perhaps 12 months before coming back and reintroducing these foods. That you would introduce them gradually, only one new food every 3 to 4 days, or perhaps even a bit longer. Start with the lower foods and then work your way up on your list. But have the foods in moderation, and I say, a modest portion, not more than twice a week as you reintroduce. And you can often now stay below that threshold that I described earlier. But if you go back to doing what you were doing, you will get to where you were. I want to make that point. You will get to where you were. So once you've avoided it for a while, it is not free reign to go and eat this liberally and enthusiastically. And retest, and yeah, the retesting can be helpful. But if the patient is doing well and they're not interested in reintroducing the foods, or I would wait until they have reintroduced the foods and perhaps there's some symptoms presenting. If they're doing really great and the symptoms aren't presenting, then I just don't retest because I don't need to remeasure if they're doing fine. So if they react to cow's milk, does this mean that they're lactose intolerant? And no, it does not. Lactose intolerance means that sugar called lactose doesn't get broken down and it migrates through to the bowel and is fermented by particular yeasts and causing a gas and discomfort, but it doesn't involve the immune system. Whereas the reaction on this test is to one of the various proteins that is contained in the dairy products. So you can be lactose intolerant and or have a food sensitivity. They do not have to be together. And that the cow's milk allergens are, sorry, I'll have to come back. So what if a client tests positive for gluten? Do they have celiac disease? And no, it does not mean that they have celiac disease. It means that we are able to demonstrate that they have a sensitivity to gluten. It certainly could be a part of leading up to celiac disease, but it does not indicate that they currently have. Remembering that celiac disease is not only that you have a significant immune response to gluten, but that it's causing a destruction of the villi, the absorptive surface, in the small intestine. So prior to that, you may not have celiac because you're not damaging that tissue yet, but over time, if you keep fanning the flames, you will get there. So here we see that the non-celiac gluten sensitivity is reported according to the Canadian Celiac Association by as many as 13% of the population. And so it doesn't confirm. There are some serum or blood tests that you can do that are much more diagnostic of celiac disease, and that would include the IgG and an IgA, which is the mucous membrane type of antibody, to tissue transglutaminase, which means that you are having damage to the tissue of the small intestine, and antibodies to gliadin, which is the reactive part of the gluten molecule. And so if gliadin is reactive but the other grains are not reactive, what's going on? Well, there are these other wheat grain proteins. And this goes for any of the high protein plant products. So nuts, seeds, legumes, grains. These are all seeds. And by definition, the proteins in these seeds need to be very stable. They're resistant to degradation, because otherwise that seed would not be very effective at germinating at some future point. It's the nature of these proteins is that they're stable. So that's why they're the hardest molecules for us to digest. And in fact, many of the legumes have an ingredient in them that further reduces our ability to digest proteins. But it's interesting that in wheat, 15% of the proteins are albumins. Well, albumins, that's common to a certain small amount of albumin protein is found in dairy and is especially found in the egg white. So this is where the common, and sure, it's a cliche, but dairy, wheat, and eggs, those are very common food sensitivities. So globulins, the gliadins, and the glutenins. And here are the proteins that we can react to. So it's not just gluten in the wheat. And that the gluten can be different in different wheat products. So why can egg white and egg yolk be different? Well, it's probably the same conversation. They have different proteins in them, and that in the egg white, especially the albumin, and so the egg yolk lacking that isn't going to be so reactive. This is very confusing for a lot of people, so I'd like to take the time to talk about cross reactions. The cross reactions in foods occur when an individual has a positive result for a food they rarely eat or haven't seen. And so a portion of that protein is the same as might be found in another food. And so they get sensitized by the one food they do take in, but yet if they take in other foods that have a very similar protein structure, then their immune system can identify it. If the proteins need only to be, give or take, about 70% identical, the homology, that they're similar on about 70% of the amino acids in that particular fragment of the original protein, that can be manifesting as a cross reaction. And the probability of there is even some probability if the molecules are 40 to 70%. So, for example, seeing that one molecule in a food, you find it in another food or a pollen. But what's most interesting to me is in the dust mite, that these proteins in the dust mite are very similar to what you might find in the musculature of the exoskeleton of the crustaceans or the mollusks. So you can see here that the house dust mite, in fact, people even to inhaled allergens will now show some level of reaction to these seafood products. Latex showing banana and avocado. And the birch tree family, which has just such interesting variety of items, where you've got the pear, but also the lychee and the kiwi, apple, but the almond and the fig, hazelnut. These are very different products, and they do have some protein ingredients in them that are similar enough to be cross-reactive. The pollens of many sorts are a very common source. If the yeast comes up positive, does that mean that my client has systemic candida? And it does not mean that they currently have a thriving candida, but that at some point, recently or farther back, that they have been having an immune response to it. But we can't say that it is currently thriving. You have to put that into perspective for yourself. And there's some more detailed testing for various antibodies that you can then use that to deduce whether it's current and thriving, it's recent, or if it's more historical, and in fact you've overcome it. So my client has started to avoid foods and feels worse. Is this normal? And it's normal, and it really is a source of distress for a lot of people, and I understand. So you get these withdrawal type symptoms, and it's related to some of the chemicals in our body that are part of the inflammatory response. And so the stimulation of that creates exorphins, which are opiate-like peptides that are found in certain foods, and they give us a pleasant feeling. So you have individuals who will talk about being addicted to a food. Well, even though it's causing them distress, they love that food because it does indeed cause the release of these opiate-like peptides, and so they feel good. And so they need to break through that, and it is a withdrawal-like symptom, and it can take a little while, but we get through. And so in the early phase, if there's very little antibody and lots of antigen, there's really no harm, no foul. But when you get late in the response, there's a lot of the antibody and little antigen because they're minimizing the food. Now you have some distress. So what's the validity of the test when a patient shows almost no reaction to it? Well, it's unusual, but it certainly does happen. And as we test more individuals who want to be tested, not because they're particularly suffering from an ailment, but that they just want to make sure that they're being a bit proactive, you will have more of the tests that are showing very little reactions. And so they may be immunosuppressed. Their immune system may not be fully functioning. A lot of people have genetic problems with their immune system, that there's a drug interference. And it can be the assay. But at the lab, if there are problems with the assay, every batch, with every batch there are controls run. But with every sample, there are also, like every individual patient, there are positive and negative controls that ensure that the samples themselves are of sufficient quality to be tested. So if there are variations, they're caught by the lab staff and evaluated, and the tests are run again. All the tests are always run twice. So if we need to, we sometimes can order a repeat test, but it often is simply the case that they are not having reactions. Not everybody has to have reactions. And so here again, we're the dietary advice based on IgG results. And the conclusion is that this is an effective, reliable, and value aid in the management of chronic illness. And that is a point I would make again and again. So I thank you for bearing with me if you've made it all the way to the end. I'm Dr. Joe Clausen. I'm a naturopathic doctor in Calgary, Alberta. My website is www.fishcreek.ca, and I would encourage you, if you need to contact me, drjoe@fishcreek.ca.